we've come up with what we call the 5-minute bedside moment, which we teach our residents and we teach our faculty if they're interested. And we've done this at many national meetings now, SGIM, ACP, and so on. And the 5-minute bedside moment, as the name implies, can be done in 5 minutes, but it's also infinitely expandable. So you could begin by doing the ankle reflex and do that in 5 minutes, but you could expand it to talk about the history of the reflex hammer, and expand it further by demonstrating all the other reflexes, and expand it further by talking about tone, and expand it further by going to the superficial reflexes. So don't hold yourself to 5 minutes, but 5 minutes is a nice placeholder. It has just 2 ingredients, the narrative and the physical diagnosis maneuver. And I'm just going to expand on that very briefly. The narrative can be the context and the usefulness of the maneuver, maybe the evidence that this is a worthwhile sign. If it's a personal experience, that's actually nice. I think that we use stories as instructions for living. Stories become placeholders. And as long as the story is reflective of the science. So I heard someone say that clinical experience is the ability to make the same mistake with mounting confidence and increasing frequency. So you have to be a little wary of clinical experience. Nevertheless, stories are good. A little vignette, a historical context, an interpretation of some of the vagaries of the text, and then caveats and common errors. And then comes the physical environment, setting up the environment, involving the patient, explaining what's to be done, modeling gentle and skilled technique, and modeling correct technique, and then having the learner do it for you. And then in our Stanford 25 sessions especially, we then watch them teach it. So we often have senior residents learn one thing, we open a divider and then have them teach it to the junior residents, so that they're not only learning the technique, they're learning how to teach it.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.